Hey everyone, it's Lindsay. Welcome to week 7 of the semester. This week we are talking about gender and sexuality and how does that impact people's health equity? How does it help in terms of disparities, or how does it hurt in terms of disparities? And so that is what we're going to talk about. For this week, your readings were mainly focused sort of on women's health and LGBTQ related sort of health, particularly with a focus on trans health. However, for this week's lecture, I'm going to switch things up. Normally when we talk about gender and sexuality, we do talk about women, and we do talk about the LGBTQ population, right? We talk about the non-dominant sort of populations and how the constructs of gender and sexuality really impact people who are outside of sort of the norm, outside of the majority. And these are important groups to focus on. That's why I had you read all of the things that you had to read for this week. However, one of the things that I really like to talk about in all of my classes, and if you've taken my classes before, you know that oftentimes when it comes to gender and sexuality, I also spend a lot of time talking about sort of the dominant groups, which is white, heterosexual, cisgender men, right? And so that's typically what we think of as kind of the highest on the privilege ladder in terms of who is supposed to get sort of the most attention. However, when it comes to health equity and other sort of things, this is actually a group that bears some pretty big disparities. And so we should talk about those sort of things. One of the reasons that I talk about white, heterosexual, cisgender men in a sort of week talking about sex and gender and sexuality is to talk about how the constructs of sex and gender are really harmful for all of us, right? We know that yes, women disproportionately suffer from a lot of things and get a lot less research and care and other sort of things. Women are believed less. Women experience other sort of things. LGBTQ population has tons of health disparities. But really, when we start to break down and look at the whole big picture, sex and gender and sort of sexuality doesn't actually serve any of us very well. And so sometimes it's easier to see how it doesn't serve us by looking at sort of the dominant groups who it should theoretically serve, right? So this week, I first want you to watch a documentary called The Mask You Live In. It's available for Chico State students through Canopy, which is a service that you get just by being a CSU student. You can log into it with your CSU login. It doesn't take very long to set up your account. The link is on Blackboard. If you wanted to watch it outside of Chico State related sort of stuff, you can find The Mask You Live In for rent on YouTube or on Amazon, Apple, a lot of different places. It's usually about $2.99 to rent it for a 24-hour period. Again, if you're a CSU Chico student, you can do it for free through Canopy. Okay. Now, why is this important? So hopefully you will go and watch that. But if you're continuing to watch the lectures, as you often do, what are the reasons that I want to talk about white, cisgender, heterosexual men? Well, when it comes to health, we see a paradox when it comes to sort of who is the dominant group in society. Again, that white, cisgender, heterosexual men. However, but when we look at sort of a big picture sort of stuff, why do we have such miserable health statistics when it comes to white, cisgender, heterosexual men, right? If we look just sort of at raw life expectancy, right? Life expectancy is how long you're expected to live dependent on sort of characteristics at birth. Well, we know for American men, your life expectancy is about 76.1 years of age. For American women, it's 81.1 years of age. Why is that, right? If men are at the cream of the crop and the top of sort of the privilege ladder, why are they dying 5 years sooner than women? Now, if we break these life expectancy rates down across sort of the intersections of race, well, we start to see even more sort of disparities. We see that Black men, not surprisingly, live the longest. White men, live the shortest. White men, second shortest. Hispanic men actually outlive white men. What? And then if we look at sort of the intersections of race and gender across women, we also see that white women, Black women, and Hispanic women are all living longer than men as well. What explains this? Why is it that men who are supposed to be sort of the cream of the crop, top of the privilege ladder, why aren't they living longer, right? If we look at other sort of health statistics, we see similar sort of things. When we look at rates of mental health and suicide, if we look at other sort of cancers and other sort of things, we actually see men don't fare very well when it comes to health outcomes and health statistics. Why is that? Well, a lot of that has to do with two concepts, sexism and patriarchy. Right? So patriarchy is a social system in which males hold the primary power. Males predominate in roles of political leadership, moral authority, social privilege, control of property, and in the domain of the family, fathers are sort of at the top of the authority ladder over women and children. And so I ask, do we live in a patriarchy? For most people, this is a very easy yes. Of course we do. But for people who remain unconvinced, if we talk about political leadership and representation in the United States, women hold 25% of the Senate seats. So out of 100 senators, only 25 of them are women and 75 are men. So that's a pretty big power differential. In terms of the House of Representatives, we have 435 House of Representative members. 101 of them, or 23.2%, are women. The rest are all men. We currently don't have any non-binary or trans identified senators that vary from the male or female category. When we look at sort of governorship, so out of the 50 state governors, 9 of them are women, which is about 18%. Out of state legislatures in total, there are 2,145 state legislators across the country. So this would be state legislators, so assemblymen, state representatives, etc. 29% of them are women. So again, that is a big sort of disparity between men and women. Out of the 1,366 mayors of U.S. cities of more than 30,000 people, about 300 of them are women, which is about 22%, right? So when it comes to political leadership, I would say here in the United States, men have all of the political leadership. I don't think this is a surprising sort of news for any of you, but it starts to build that case of we are living in a patriarchy. So again, why is it that men are having such poor health outcomes? If we look worldwide, just for a snapshot, out of more than 200 countries in the world, there's about 23 heads of state. 23 out of 200. Again, worldwide, men clearly have the upper hand in terms of political power. So let's talk about some of the other sort of things that patriarchy and sexism tell us about men. We hear these sort of things that men are supposed to be strong and tough and unemotional. Again, that is up to debate, and a lot of stuff comes up. But this is what patriarchy says men should be. Men should be expected to take care of their family, to take care of women and children, but only in indirect ways, right? Through money, through physical defense. I'll go and fight for my family, but not in sort of caretaking, right? We give that to sort of women in terms of the gender constructs. We have a lot of ideas about men are just simple creatures, right? They mostly just care about sex, food, sports. They don't care about depth. They don't do these sort of things, right? Which is a really sexist point of view in terms of thinking about how men are not complex. We think that men should be risk takers and thrill seekers, and they should do these sort of things. Coincidentally, that leads to really high rates of unintended injuries, high rates of accidental sort of things. And so when we look at disparities between men and women in terms of injury rates, men are off the charts. Well, no freaking wonder, because we expect men to be the motorcycle sort of people and jumping off of building sort of people, and there's a lot of these other sort of things. All of these ideas about what men should be in terms of patriarchy lead to a lot of the health outcomes that we see these huge disparities in, right? This idea that men should be strong and tough and unemotional. Well, then is it any surprise why men die from mental illness? So in terms of suicide, is it any surprise that men have stress-induced heart attacks? When we look at heart disease, it's the number one killer of men. Well, maybe because you're keeping all those things inside, and you have all this stress of taking care of your family, being the earner, doing all these sort of things, not allowed to talk about any sort of feelings. All you have to talk about are sex, food, and sports, which again, if those are your big sort of things, well, that's probably leading to some of the diet related sort of stuff that we see in our country. So when I say, let's look at sexism and patriarchy and what it says about men, right? We know these are not all true things, and we know that they are stereotyped, and we know there are things that are objectified and pushed on to men. However, this actually translates into real live stuff in terms of health discrepancies and health disparities for men. So is it that perhaps sexism and patriarchy are at the root causes of all of men's health issues? What? Yeah, if this is true, then shouldn't we all be feminists? Oftentimes when I talk about how I'm a super strong, radical, out there feminist, people always assume it's because I hate men, right? Actually, no, I love men. I love men more than most people love men because I see men as an important, inherently good sort of creatures that should be taken care of, that should have special considerations, because I think sexism and patriarchy hurts everyone, including and sometimes especially men. And so, yeah, my feminism is grounded in the fact that patriarchy and sexism is bad for everyone, not just for women, not just for LGBTQ people, but even for men. Patriarchy and sexism doesn't serve them well. And in fact, it leads to lower life expectancy, poor health outcomes, and all these other sort of things. And so my feminism really is wrapped up in this idea that we should treat people as individuals, that we shouldn't have these weird gender stereotypes stuck on certain people for any sort of reason. Now, if we want to talk about what encourages men to get care, right? I've just talked about all these sort of societal messages that say men shouldn't do these sort of things, which leads to poor health outcomes. Well, why do we spend a lot of time talking about women's health and LGBTQ health and health that doesn't involve men? Well, part of that reason is because we don't really know how to reach men. Looking at some things, and I have in the lecture slides this week, looking at a meta-analysis of over 11,000 different studies. They looked at different sort of things of what gets men to engage in healthcare and how do we improve men's uptake to health services. And frankly, what we found was that we don't really know. There's not a lot to get men to uptake services more than if we just targeted women and other sort of people through ethnic healthcare, through LGBTQ healthcare, that we sweep the men up in those sort of things, and that even if we invest additional extra money specifically in targeting men, most of the time it doesn't pay off, right? And so this is why we see such a huge focus on women's health or on minority health or on LGBTQ health, because we know that those health messages will eventually get to men. And even if we spent all of our money on all of our interventions in public health education, just focusing on men, it wouldn't actually make a difference. Now, there's another big study in terms of thinking about health promotion that looked at sort of thousands of other sort of things. And the one and only way that we see we can sort of like tip the scale in terms of getting men into healthcare is to appeal to sort of these patriarchal views of men. So if we go to bars, if we incorporate it with sports, if we look on male specific sort of language, if we emphasize sort of sexuality, well, then we get a little bit of investment for our money. Again, it's that appealing to their masculinity sort of stuff. But we also know that's the stuff that is harming men in the long run, right? And so we're stuck in this sort of hard case. If we want to get men invested in their own care and to be interested in health care uptake and all these sort of things to improve their health outcomes, either A, we do nothing because they'll eventually get the message through sort of other channels, or we appeal to sort of sexist, patriarchal sort of methods of health education, which actually only perpetuates the issues that are causing some of the problems, right? So we're really in a bind here. And that's why I talk so much about men's health, even when we're talking about gender and sexuality and all these other sort of things, because I think it's really important that we acknowledge and say that, hey, sexism and patriarchy hurts everybody and it helps nobody. And so we need to start breaking down these constructs and say, if we truly believe in equality and equity for everyone, yeah, that also includes men, right? It also includes people who seem to have sort of the top of the privilege ladder. Actually, they're really suffering too. Okay, so that's what this week's lecture is about. Again, watch the documentary. It's really great. It gives you a new sort of perspective into how we construct sort of this idea of masculinity. And then you'll have your discussion this week based on kind of looking at gender and sexuality as a construct. All right, thanks.